Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. I have carpal tunnel, what can I do? So I have a carpal tunnel playlist tab. It's a free series that's on my TikTok homepage. It's one of the tabs. It takes you through what is and what isn't carpal tunnel and what you can do to treat your symptoms. This person writes that I have carpal tunnel on both arms during my pregnancy. Is there anything for this? Well, a lot of times during pregnancy, you're getting your carpal tunnel symptoms for two reasons. One of them is just added pressure, inflammation because of the pregnancy itself. But the other one is because during your pregnancy, you become more and more limited with your stomach movement, more and more limited bending forward. So in order to accomplish this motion, you have to do so more at your upper back and your neck. And now this is the area where your nerves come out of to travel down your arm and innervate your carpal tunnel area, these three fingers. And a lot of times, pregnant women or women who just gave birth and they're nursing, they're the ones that are getting these symptoms, and it's not coming from their pregnancy, it's not coming from swelling or inflammation, it's actually coming from your neck and upper back. And treating these areas will fix your problem. So if you want to know more, go see my series. If you want to see me, go to thespinaltruth.com, set up a consult or a session. Not sure if it's Crohn's or something else, you're not alone. So this person writes, I have one doctor saying it's Crohn's and I have one doctor that won't rule out something else. Labs came back negative for Crohn's and IBD, so I'm just sitting here like, now what? Yeah, you're not alone. So many people out there were diagnosed with IBS and then ulcerative colitis and then Crohn's and then something else or SIBO because they're all about the same. They all have a very similar presentation and there is no one test. There is no test that can come back positive and say that you have Crohn's. There is no test for Crohn's. There are just signs and symptoms. And after a while, you put enough of those signs and symptoms together and maybe you rule out some other things and now you say the most likely is Crohn's. But a lot of times this gets misdiagnosed just like a lot of other things in the medical system. So if you're not getting relief from your treatment, if you're not seeing improvements, maybe start to think that not just the treatments might be wrong, but the diagnosis itself. And if you want to know a little bit more about what else could be causing your GI symptoms, look to my YouTube channel or my Spotify podcast. I talk a lot about how Crohn's GI symptoms can come from the spine. The spine, the nerves that get to the intestines can be involved, and that's causing all of your symptoms. And even better, I interview patients that were treated this way, patients that were diagnosed with Crohn's, diagnosed with ulcerative colitis, did all of the treatments, all the prednisone, all the biologics, they were hospitalized, they had bowel obstructions, all the same symptoms that you would get with Crohn's, with ulcerative colitis, and they still weren't responding. And when we treated their back, everything got better. So if you're out there and you keep getting a lot of opposing information, maybe you need to start looking elsewhere. For all you Instagram people out there, your tennis elbow is not coming from your elbow, it's coming from your neck. And I know you hate when I say this, but look, this person writes, Doc, this worked for me, thank you. I also sit at a computer for about 10 hours. This has really helped me and it also helped my thoracic outlet. Yeah, you know why it helped? You know why you got tennis elbow or elbow pain from sitting at your computer? It's because the position your neck's in, not because of your wrist, not because of your elbow, not because of overuse from typing. That just doesn't make sense. And that's what we're told. And that's why your treatment at your elbow isn't getting you better. Most people out there are getting elbow pain, getting arm pain just from daily life, just from sitting, driving, cooking, looking down, sleeping, reading, computer work. It's all in this position and it's all stressing your neck and upper back significantly more than it's stressing your arm. So if you're out there and you have arm pain, elbow pain, start thinking neck, stop thinking elbow. Is an inversion table or spinal decompression good for you? I've used these treatments a lot in my career and I've stopped using them. So that should give you your short answer. In general, I tell people that, look, if an inversion table really worked, you would see one in every chiropractic, physical therapy, DO office because we can put you in it, we can walk away and we could charge for it. But ultimately, even if it does make you feel better, it does nothing to change you long term. And that's where you should be putting your time, energy, and your money. Because as you do an inversion table or a decompression, it's supposed to pull you apart a little bit. This gives you a little bit of space through your joints, specifically your disc, your back, and it feels good in the moment. But when you stand back up, when the table loses its pull, now you're right back to where you were. You've gained no range of motion and you've gained absolutely no strength, the two things that your body needs to feel better. So maybe it feels good for some people. Maybe it's helpful for some people, but it still isn't going to get you back to the point where you have now fixed the problem and you will stay better. So in general, I don't use these anymore for those reasons. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.